Hello everyone, welcome to my channel. Today we are going to learn about types of blood samples and anticoagulants used in the blood samples.
Types of blood samples. There are three main types of blood samples submitted for tests: whole blood, serum, and plasma. Firstly, we are going to learn about whole blood. Whole blood sample is the anticoagulated blood sample containing all formed elements as well as plasma. The uses of whole blood are for complete hemogram, fetal hemoglobin determination, osmotic fragility, HP electrophoresis, Coombs test, biochemical estimation of glucose and urea. Next, we are going to learn about serum. When freshly collected blood without any anticoagulant is allowed to stand in a tube for at least 1 hour, serum separates on the top while clotted blood retracts at the bottom of the tube. The yield of serum can be increased by centrifugation at 3000 rpm for 15 minutes. Serum does not contain most of the coagulation factors. The main uses of serum are for quantitative biochemical determination of most components of metabolism, enzymes, hormones, and markers, for electrophoresis of proteins and immunoglobulins, and serum antibody tests. Next, we are going to learn about plasma. Plasma is obtained by centrifugation of anticoagulated blood. After centrifugation, the plasma lies as a supernatant in the tube. The bottom of the tube contains RBCs, while other formed elements of blood like leukocytes and platelets lie at the junction of plasma with sedimented RBC. Plasma are used for coagulation studies, for factor assay, for tests of product of coagulation, for example FTP D-dimer, for biochemical investigations like glucose. You can see the separation in right side tube. Now we are going to learn about anticoagulants. Anticoagulants are used to prevent clotting of blood specimen in such a way that the anticoagulant does not cause any alteration in blood plasma or formed elements. Although the choice of anticoagulant to be used depends upon the determination to be made. Some of the commonly used anticoagulants in hematology laboratory are EDTA, ethylene diamine tetraacetate, sodium citrate, double oxalate, heparin, and sodium fluoride. The first anticoagulant we are going to learn about is EDTA. EDTA is by far the most commonly used anticoagulant in hematology laboratory. The mechanism of K2-EDTA as anticoagulant is by removal of free calcium from blood by chelation. EDTA can be either used as solid salt for 2 mg per 1 ml of blood or as a 1% solution in distilled water for anticoagulation. It is the anticoagulant of choice for all cell counts and peripheral smear. The advantages of EDTA anticoagulant are: EDTA preserves the morphology of the blood cells up to 3 hours and cell counts up to 12 hours after collection of the blood. The disadvantage is it is not suitable for coagulation studies. The color code of EDTA vacutainers is purple or lavender. Next, we are going to learn about sodium citrate. Sodium citrate is another commonly used anticoagulant. It prevents coagulation by loosely binding free calcium ions of the blood in a soluble complex, calcium citrate complex. Uses of this sodium citrate are for coagulation studies, ESR by Westergren method, blood bank CPDA, citrate, phosphate, dextrose, adenine used as anticoagulant for donor's blood. The disadvantage of citrate sample is it is not suitable for other routine hematologic tests such as CBC, blood smear, etc. due to dilution of blood. The color code of citrate tube is sky blue, and for ESR it is used in black with different dilutions, and CPDA in donors blood collection bags. And the next one is double oxalate. In hematology laboratory, a double oxalate is used as anticoagulant. Sodium or potassium with ammonium oxalate in the ratio of 2:3 is used. Oxalate combines with calcium in the blood to form insoluble calcium oxalate. thereby preventing anticoagulant. It is widely used in coagulation studies, can be used for CBC and ESR and PCV by Wintrob method as well. The color code for oxalate tube is gray. The next anticoagulant is heparin. Heparin is used when almost instantaneous or immediate anticoagulation is required. Uses of heparin are osmotic fragility tests done for diagnosis of hereditary spherocytosis, red cell enzyme studies like G6PD deficiency, electrolyte estimation, arterial blood gas analyzer. Disadvantages of heparin are expensive, cause clumping of platelets and leukocytes, so it is not used for automated cell counters, imparts bluish discoloration to the background of peripheral blood smears. The color code of heparin tube is green. The next and last one is sodium fluoride. Sodium fluoride is used for blood glucose estimation and is not used for hematological tests. It acts by inhibiting red cells glycolytic enzyme pathway. The color code of fluoride tube is gray. If you find my video is useful to you, please like and don't forget to subscribe to my channel, and please hit the bell icon. Please share the videos with your friends and family, and thanks for watching.